Assalamu alaikum, everyone. I'm Dr. Rehan Zafar from the Department of Nephrology, Combined Military Hospital, Lahore. It is an honor to be here to present our research titled Sleep Disorders Among Patients on Maintenance Hemodialysis that are Predictable. This work was conducted in collaboration with Dr. Rahat Hussain, Dr. Rao Muhammad Walid, Dr. Abdurrahman Arshad, Dr. Aisha Munaf, and Dr. Rizwan Yusuf. We hope this research not only like add up to the growing body of evidence on sleep disturbances in end-stage renal disease patients, but also sparks meaningful dialogue on how can we improve the lives of patients who rely on maintenance hemodialysis. Let's just introduce this chronic kidney disease. Chronic kidney disease, or CKD, is a progressive illness marked by a gradual, irreversible decline in kidney function. At its most advanced stage, end-stage renal disease, patients become dependent on hemodialysis, renal replacement therapies, which are either through dialysis or kidney replacement transplantations. We may succeed in keeping our patients alive with dialysis, but by doing this, we often overlook a very traumatizing experience of the patients, that is sleep disorders. These are not just occasional restlessness or mild insomnia. We are talking about insomnia, sleep apnea, restless leg syndrome, excessive daytime sleepiness, and periodic limb movements, all of which are disturbingly prevalent in this population. According to earlier data, up to 83% of patients on maintenance hemodialysis report some form of sleep-wake disturbance, with excessive daytime sleepiness being the most common reported symptom. These disturbances are far more than just inconvenient. They impair immune function, worsen cognition, and significantly elevate risks for cardiovascular complications and even mortality. The question that drove our study was simple but important. Given the multiple stressors faced by these patients, biological, psychological, and procedural, can we predict who is at higher risk of sleep disorders? And if we can we intervene in earlier and more effectively? Were our objectives? Our objectives were straightforward and yet impactful: to evaluate this frequency of sleep abnormalities, specifically excessive daytime sleepiness in patients on maintenance hemodialysis, and to identify predictive factors that could help us proactively screen at-risk patients. In our methodology, it was an observational study over a 2-month period, January 2025 to February 2025 at CMH Lahore. We enrolled patients aged 13 years and older who had been on maintenance hemodialysis for at least 3 months. We excluded those with significant physical disabilities or limited mobility, defined as being restricted to their bedroom and washroom. Those who had used sedatives in at least 2 of last 4 weeks, and of course, anyone who declined consent. 2 standardized tools were used for patient interviews: the Epworth Sleepiness Scale, ESS, which assess daytime sleepiness based on the likelihood of dozing off in 8 common daily situations, and a score of 11 or more was considered abnormal. the Fatigue Assessment Scale FAS, which evaluates both mental and physical aspects of fatigue with scores ranging from 10 to 50. Additionally, we traced different biochemical investigations. This included hemoglobin, albumin, calcium, phosphate, and intact parathyroid hormone levels. Data analysis was performed using SPSS version 24, and binary logistic regression was applied to identify any predictive association. In our results, we enrolled a total of 81 patients, 55 males and 26 females. The mean age was approximately 52 years, and the median duration of the hemodialysis was 14 months. The median ESS score, Epworth Sleep Scale score was 6, but 12 patients, 14.81%, scored more than 11, qualifying them as having excessive daytime sleepiness. Let's discuss the significant findings. First, female gender was strongly associated with excessive daytime sleepiness with an adjusted odds ratio of 5.87 and a statistically significant p-value of 0.023. Second, higher scores on the fatigue assessment scale were also significantly predictive with an adjusted odds ratio of 1.21 per point increase and a p-value of 0.002. In contrast, variables like age, dialysis vintage, or frequency, and all the lab markers, including hemoglobin, albumin, calcium, phosphate, and parathyroid hormone, showed no significant predictive values. What does this study tell us about? First, it confirms that sleep disturbance in hemodialysis patients are both common and clinically significant. Our finding of 14.8% with excessive daytime sleepiness is consistent with international studies using the same assessment tools. The gender difference was specifically interesting. Although some studies report more sleep complaints in males, females tend to score higher on sleepiness scale and are more likely to use sleep medications in our study. This could be linked to hormonal variations, psychological stress, or social cultural factors affecting the rest and recovery. Fatigue, as expected, played a central role. It is a well-established correlate of sleep problems and likely operates bidirectionally. Poor sleep worsens fatigue, and chronic fatigue impairs sleep. Interestingly, we found no link between sleep disorders and lab parameters. While one might assume that abnormalities in hemoglobin or electrolyte levels would contribute to sleep issues, this lack of association reinforces that sleep quality is a multifactorial issue, often more related to psychological and behavioral factors than isolated lab values. This aligns with the findings of Novak and others who describe sleep disturbances in end-stage renal disease patients as the result of complex biological, psychological, and social interactions rather than just physiological imbalances. And these disturbances are not benign. They have been linked to increased cardiovascular events, missed dialysis sessions, poor medication adherence, and cognitive decline. In some studies, poor sleep independently predicts mortality. Of course, like any study, our study had its limitations. The relatively small sample size, while adequate for regression analysis, may limit the broader applicability of our findings. We relied on self-reported tools, which is like FAS and ESS, despite being validated, can introduce subjectivity. Certain potential confounders, such as psychiatric comorbidities or lifestyle factors, were not measured and may have influenced the results. Lastly, although laboratory parameters are often emphasized in clinical settings, our study did not find them predictive of sleep disturbances, highlighting the need for a more holistic patient assessment. In conclusion, sleep disorders in patients on maintenance hemodialysis are real, common, and clinically relevant. The Epworth Sleepiness Scale offers a quick and reliable bedside tool to screen for excessive daytime sleepiness. In our study, female gender and fatigue emerged as key predictive factors. Interestingly, lab values, which are often the primary focus, did not predict sleep disturbances, reminding us of the human and psychological dimension uh, of chronic disease care. Improving sleep quality could lead to a better adherence, fewer complications, and a significantly improved quality of life. Targeted interventions like cognitive behavioral therapy, structured physical activity, melatonin supplementation, and efficient dialysis not only hold promise, but demand further exploration as they could redefine the standard of care and transform lives. These were the references. Thank you so much.